Hi, everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local, and today I've got two guests with me. Dr. Melissa Richards, we know her. She's the Division Chair of Hospital and Surgical Services at Olmsted Medical Center. And our guest today is Carrie Rochester. Yes, Carrie Rochester. She is a certified nurse midwife at Olmsted Medical Center, and she's also certified sexual health counselor. Hi, this
Hi.
is going to be fun.
Hi. It's
I
gonna be
can't
so
wait.
good. I'm so interested.
Yes,
Oh.
sexual health specialist. So first of all, let's just talk about the fact that Olmsted Medical Center has someone
hmm
as wonderful as that on their team. Talk to us about how this came about. Sexual health counselor. What does that mean? What does it entail? Let's just start there.
Okay. So I have been a certified nurse midwife since 2010.
Mm-hmm.
Um, and I just started to notice a trend either during prenatal or even postnatal, women talking about difficulties with libido, especially after having
Oh yeah.
babies. Yeah.
Mm-hmm.
Like, oh my God.
Super
Yeah.
normal,
Like,
right?
I do not
Mm.
want him touching me.
Uh-huh.
Right. And but then wanting the desire to be intimate with their
Yeah.
partner, but not feeling that desire. And I felt so ill-equipped to
Yeah.
handle those
Yeah.
questions, which really started to bother me.
Yeah.
I didn't get a lot of training about it in
Mm-hmm.
nurse midwifery school.
Okay. Yep.
So I just felt that that is something that needs to be addressed because sexuality is a part of our being, right?
Mm-hmm.
It's a very important part of our
Right.
lives.
Yeah.
hmm So I did some research on how to gain more education, more training,
Mm-hmm.
and to provide that service. So
Wow. And so when was that specialty first kind of offered at Olmsted Medical Center then?
I finished my training last year in the summer. And I started offering it to patients that I was seeing in the clinic, and then everyone
Mm-hmm.
else in our department knew
Yeah.
I was doing it. So then they started sending patients to me as well.
That's pretty amazing, honestly, to have something um so important, so tangible and available.
hmm
That's what I think. It's not like you have to call whoever or whatever the case
Mm-mm.
is you just see your primary and talk about it,
hmm
and then you
hmm
can get a referral or
And people don't necessarily
mm-mm.
even need a referral.
Amazing.
Yeah, they can just call. And we also are offering people to schedule an appointment online through my chart. So they don't even have to
Amazing.
call.
So
My
nice.
chart is
Yeah.
great. That's great. So as a department, as an OBGYN department, you see patients all the time. You're seeing patients for pelvic health, perhaps are expecting. Dr. Richards, why is it so important to have someone like Carrie Rochester with their knowledge and expertise in sexual health? Why is that important to the department?
Yes, and piggybacking off of what Carrie said, so little training that we do
Yeah.
in our residency program. We receive very little training. A lot of the training is you should ask.
Yeah.
You should ask. Ask, do you have any sexual health concerns? And then quickly piggyback that with, does it bother you? And if the patient says it doesn't bother them, then move on to the next. Right.
Yeah.
So it's a quick conversation.
Yeah.
It's really common for us to not ask questions, I would say, when we don't have good answers
Uh-huh.
sometimes. So you're counting on the patient to bring it up. So the beauty of this is I would say about, I don't know, 50% of my patients who come in for well exams have sexual health concerns.
Sure.
And now I feel empowered to ask
Yeah.
that question. I feel really good about asking that question because I have a resource now. So I carry what in the last 6 months, I've sent you so many patients
Mhm.
who have
Mhm.
sexual health concerns. And then I'm able to say, well, we have a sexual health specialist here,
Yeah.
explain, kind of make them feel a little comfy with the idea of talking to you. And then I shimmy them over to you.
Just to protect patient confidentiality. I have been working with a patient that she did send me, and we're like slowly starting to see improvement. And like I tell patients, it's baby steps. You're not going
Yeah.
to leave the office having all this desire and increased libido.
Uh-huh.
It's baby steps.
Sure. And this is just one of the things that you can address in your
hmm
clinic.
hmm
Decrease libido, and working on increasing desire and these sorts of things, what are some other things that you might see in the clinic?
Orgasms. Let's talk about
I
orgasms.
was going to say anorgasmia.
Yes.
Yeah.
What is anorgasmia?
You're not able to achieve an orgasm.
Oh,
Mm-hmm.
okay. So that's something that you see in the clinic
Mm-hmm.
and can address and can talk through
Mm-hmm.
and counsel through and these sorts
Mm-hmm.
of things. And what about else? What about something else? Maybe I know that you see pain during sex.
Yes.
Mm.
So pain during sex can encompass a multitude of reasons, as Dr. Richards
Mhm.
know, genital urinary symptoms of menopause,
Mhm.
a condition called vaginismus, where the pelvic floor tightens up anytime you try and introduce anything into the vagina.
Mhm.
Or some people have what's called deep penetration pain. They kind of feel it like deep in their pelvis.
So all of these things are things that you are specialized to discuss and
Mm-hmm.
treat and come up with programs to work on treating these sorts
Mm-hmm.
of things, which is obviously, you know, sexuality in any sort of relationship is really important,
Mhm.
and it's a normal function of a
Mm-hmm.
relationship, and
Mm-hmm.
in a lot of cases, and so having the specialty at OMC is a huge benefit to patients there. What is the typical, age range or demographic, or what does a patient look like that comes to your specialty?
I see patients anywhere from childbearing age all the way up to postmenopausal.
Wow, that's so. What strikes me about what you just said there is that is a huge range
Mhm.
of
Mm-hmm.
people. And what did you say? 50%
It's
or
huge.
50% of people that you'll see in clinic have some sort of.
Absolutely. It's with the ability to have Carrie in the office, I just
Mhm.
am so much more open in asking those questions at well exams
Yeah.
that I have noted that I bet roughly 50% of my patients, when you ask about sexual health, they have some type of concern.
Yeah.
Um, and just to know that this resource is available,
Yeah.
because my visits are all 15 minutes and
Mhm.
30 minutes.
Yes.
Carrie has a little bit of a different setup, and I just love that OMC appreciates that it's complex and it's
Mm-hmm.
complicated. It's about
Right.
building a relationship with a
Mm-hmm.
clinician.
Mm-hmm.
Right.
Mm-hmm.
And we're not talking about like, hey, is my scar infected? We're talking
Mm.
about very intimate, vulnerable topics.
Mhm.
Um, and so that's great that you get a little bit of extra time with your patients. And going back to this 50% number that just keeps sticking in my head
Mhm.
is, wow, that's 1 out of 2.
Mm-hmm.
So we're talking about normal, normal, normal.
Super normal.
So,
And that's still people that aren't admitting it
Oh,
either.
I think the number's way
mhm.
high.
Yeah.
I mean,
Yeah.
come on
Yeah.
now.
I know.
Like, I've got
I
a
know.
list of stuff to do, and sometimes having sex just isn't on that
Right.
list. I'm
Right.
so
Right.
tired. It's like take, take,
Right.
take, and then
Right.
another thing. And
Right.
Mhm.
I mean, come on.
I know.
Right.
In our lifetime, I think everyone goes through some sexual health
I know.
concerns.
So, full circle,
Mhm.
coming back to what we talk about here on Pelvis Party all the time is no shame.
Mm-mm.
Right.
So normal. If you're experiencing any of these things, so is 1 out of 2,
Mm-hmm.
right?
At
Mm-hmm.
minimum.
At
Mhm.
minimum.
Mm-hmm.
So there is no shame
Mm-mm.
whatsoever in expressing the desire
Mhm.
to better yourself in this
Mm-hmm.
area. Golly, I just think that the more that we can talk about these things and how normal they are, the more open people will
Mhm.
be to receiving treatment or even the idea of talking to someone. And
Mhm.
that's freeing, right?
Yeah. I try and really emphasize to people that they're not broken.
Oh, yeah.
Mhm.
And I try to steer away from the word normal
Oh,
because what's normal for one person
mm-hmm.
may not translate to what's quote unquote normal for a different
Yeah,
person. And if I use the word normal, if somebody's not experiencing that normal, I don't want them to feel like
right.
they're broken.
So there is no baseline. There's
Mm-mm.
no normal baseline. It is
Mm-mm.
getting to your comfort level. It's
Mm-hmm.
getting to someone's personal
Yeah.
understanding
Yeah.
of
About
what they
meeting
want to get.
them where they're
Yeah.
at.
Yeah, that's exceptional.
It's so in line with what we do at OMC,
Yeah.
right?
Mhm.
personalized care.
Mhm.
We see every person as a person, and we want to make sure that we're meeting the expectations of that person. And as we always say at Pelvis Party, don't settle.
Do not.
Do not settle.
Don't settle
Mhm.
for what you have if you want something different,
Mhm.
right?
Mhm.
Carrie, it's awesome that we get to talk to you on another episode. So I think that we should tell everybody to stay tuned for the
Mhm.
episode when we talk to you about pain during sex. So on that note, we are going to wrap up this episode of
Okay.
Pelvis Party, and thank you so much to the both of you for being here. And if you're interested in more episodes about Pelvis Party, you can go and see those at rochesterlocal.com/pelvis party. Thank you so much for joining us, and we will see you next time.